everyone. We are with Ms. Chelsea Clinton today for WHF Talks Live as part of WHF Digital Series. As Vice Chair of the Clinton Foundation, Ms. Chelsea Clinton works alongside the Foundation's leadership and partners to help create economic opportunity, improve public health, and inspire civic engagement and service across the United States and around the world. She also serves on the boards of the Clinton Health Access Initiative and the Alliance for a Healthier Generation. We will be discussing all about it today and look forward to hearing more. Welcome, Chelsea. It's a great pleasure to welcome you with us today.
Fred, thank you so much for having me today.
I would like to start with my first question then. As just mentioned, the Clinton Foundation has numerous initiatives which aim to overcome complex challenges. One of these initiatives is the Too Small to Fail one, in which you have aimed to focus on promoting early brain and language development. Can you outline for us the successes of this initiative, especially considering the context of COVID-19, in which children globally have seen their education affected?
Well, Fred, thank you. It's such an important question. We know that 80% of our brains are built by the time we're 3. So we know that kind of the first days, weeks, months, years of life of child's development are so crucial to ensure that they have the kind of intellectual, but also the social, emotional, neural scaffolding to help them thrive and succeed for the rest of their hopefully long and healthy life. And yet we know far too children anywhere in the world, including here in the United States, are able to grow up in language-rich environments to help ensure that they are hearing truly just the volume of words that kids need to hear to help their brains begin to sort through them, to categorize them, and also to really build their brains. And so what we try to do at Too Small to Fail is to make it easier for parents and other caregivers to read, sing, and talk to their kids. So with kind of very simple strategies on how kind of any moment can be a literacy rich one. So whether that's kind of doing the dishes or the laundry or bath time or changing a diaper, or when we're not kind of stuck at home, like, at a bus stop or kind of in a car, in a grocery store with a child. We also have, with our partners, now donated well more than 1 million books to low-income families, because we know that in many low-income neighborhoods in the United States, there'll be kind of one book for every 100, 200, 300 families. We've partnered with diaper banks and food pantries to distribute those books so that the burden isn't on parents or caregivers to go to another place to access those books, that books are available kind of where they're already spending time. And we've worked to truly just build more words into the environments where children, again, in a non-COVID moment, are. So whether that is their pediatrician's office or a playground, a bus stop, their religious communities, for children, unfortunately, who have to be in the court system, the courts where they may be spending time, because we believe that every word that a child hears really matters. And we want to make it easy for parents, caregivers, and really any adults in a kid's life to be part of that work. And we hope that what we are proving here, because we do have very robust, completely independent studies that show our work really is making a difference in increasing in terms of both the number of words that kids are hearing, but also the time that they're hearing words in their early lives. And we know that'll correlate to strong brain development. We hope that work really can be useful to other organizations that may want to do similar work around the world.
That is a fantastic initiative, definitely an example to follow. I really do hope that is going to be spread around the world, and it will be an initiative to follow by many countries and also by many stakeholders. shouldn't go without saying COVID, really, and really discussing about it. Public health has also been severely affected by this ongoing crisis, and we have seen how COVID has affected other health issues, including vaccine hesitation. With regards to equitable vaccine distribution and education, what are the key messages to communicate to communities across the US and also in low and middle income countries, do you think?
Right. It's a question I think about every day. And as we're talking about this COVID moment, I think you can hear one of my children who's having a very vigorous kindergarten at home experience right now. And this is just the reality we all find ourselves in. If we are those of us who are privileged enough to be able to work from home and are privileged enough to be able to keep our families safe, because while we are all living through this COVID-19 moment, we are certainly not all experiencing it equally. Where we live, the resources available to us have drastic impact on our own experiences during COVID-19, where we live in terms of our neighborhood, certainly, but also in terms of the leadership that we're living under. Feraye, you talk about kind of, COVID-19 at a global level, and yet we've seen clearly there's been radically different leadership that has really facilitated protecting public health, ensuring that hospital systems aren't overwhelmed, ensuring that there aren't kind of excess deaths due to non-COVID causes because those hospital systems are overwhelmed. We've seen that with countries that kind of ramped up testing earlier and enabled kind of then very good contact tracing and kind of isolating patients with dignity because it could be built on the backbone of strong testing. We've seen that in places where kind of maybe the first wave began to surge, but then they were able to kind of deploy all, conventional public health measures to kind of flatten and then crush the curve. And then we've seen countries, unfortunately, for like where you are in the United Kingdom and where I am in the United States, where we haven't had good public health leadership. We're still now in early 2021, we aren't testing enough people for COVID, much less ensuring that people who do test positive are able to isolate kind of with safety and dignity and sufficient support. We're certainly not vaccinating enough people. And you ask about vaccine hesitancy. We know that, in late 2019, looking to 2020, the WHO declared vaccine hesitancy one of the 10 greatest threats to global health. Because it's not only in the UK and the US where we've seen rising levels of vaccine hesitancy and just outright kind of vaccine denialism and anti-vax sentiment. We've really seen challenges to science and scientific literacy and kind of vaccine acceptance all over the world. And so when we think about the work that we have to do to distribute the vaccine to ensure that the vaccine turns into vaccination, certainly combating vaccine hesitancy and building public confidence in vaccine has to be part of that work. And it has to be work that hopefully not only has applicability to COVID-19, but also to other vaccinations that we know are so critical, especially for kids to receive in the first 5 years of life. I think about measles, rotavirus, pneumococcal against pneumonia, and so much else. And what we've seen really to work are a few things. We need to continue to put pressure on the big social media companies to take down and disallow anti-vaccine content. So whether that's kind of YouTube or Facebook, WeChat, Instagram, so, any and every platform that anyone listening to us may think about. And we know we need to continue to invest in supporting healthcare workers to have the time and the conversations that often are necessary to talk to people to answer the questions they may have about the COVID vaccine or about any vaccine. Because we know that kind of deep engagement, whether it's from, a nurse in Portland, Oregon, here in the United States, or a nurse in Lagos in Nigeria, or a nurse in Bangkok in Thailand. It's those conversations that often help people let go of the kind of anti-science questioning they may have and really understand why it is in their best interest to vaccinate themselves and their kids. So we do have so much work to do. And I yet hope that this COVID-19 moment is a place where we can do work that helps really expand scientific literacy, helps hopefully inoculate people, almost vaccinate people against the susceptibility to anti-science content and rhetoric, and build real confidence in not only the COVID vaccine, but in vaccines and vaccination more broadly.
Yeah, we discussed just about vaccine hesitation. It's a big issue and big topic, but at the same time, equity, health equity, hence vaccine equity is quite a big issue as well. And WHO defines health equity as the absence of unfair and avoidable differences in health among population groups defined socially, economically, demographically, or geographically. In your work in this area, what are the main challenges that you have seen to the equitable distribution of health? And what are the challenges you expect to see for the equitable distribution of vaccine?
Well, we're already seeing the challenges around the equitable distribution of the COVID vaccine, and we're seeing kind of equity challenges in a few ways. One just in the purchase of vaccines. So, we have many countries that have secured kind of the right to forward purchase, enough vaccines to vaccinate their populations many times over. I mean, we see this especially with Canada that has purchased enough vaccines to kind of, potentially vaccinate its population 6.5 times over. And then we look kind of in contrast to COVAX, which is the effort led out of Gavi, the Global Alliance for Vaccines, in partnership with many other kind of multilateral organizations that has now believes it has hopefully secured enough funding to procure and help distribute vaccines to vaccinate just 20% of the population in low and lower middle income countries. And then we also see, Fred, the question of equity in the type of vaccine. So we see that lower income countries that have been able to kind of secure some vaccines, it's often vaccines that have 65% efficacy, versus the Moderna and the Pfizer vaccines that are being purchased by the wealthy world that have 95% efficacy, right? So that's another real highlight of inequity, or we kind of see inequity in the expected pace of distribution, which is not only about the purchase of the vaccines, it's also about having the distribution capacity, everything from having enough trained healthcare workers to be able to vaccinate people, to having enough refrigeration or cold storage capacity to store the vaccines, to ensure that kind of their integrity is preserved so that people can be vaccinated, and that's another major challenge. I mean, we kind of hear timelines like from the United States or the UK, where you are, or elsewhere, where governments were saying we expect to be able to vaccinate substantially all of our populations this year, and then kind of we hear many lower income country governments saying they don't think they'll be able to vaccinate even a significant portion, much less substantially all of their populations, until well into next year. And so, we see inequity, right, in everywhere that we look on the question of the COVID vaccine. And I think, it tragically highlights just the inequity across public health, depending on where people live. Although I also don't want to lose the point about kind of why good governance matters, and why having kind of public health minded and kind of appreciative and kind of a willingness to listen to kind of public health experts really matters, because we're seeing even now kind of during these early weeks of vaccine rollout, some countries are just doing a much better job. So even in the wealthy world, there's some countries that have been much more well organized to be able to kind of vaccinate vulnerable people more quickly, to ensure that there's good tracking of patients after the first vaccination, so that they know who to kind of recruit back and at what time, for the second dose of the vaccines that require it. So, even in the wealthy world, we're seeing kind of a different type of inequity play out based on kind of the competence of the government and the leaders in power.
Yeah, my question would be about, yes, these are the challenges, but what would be the solution to it? But you already answered it. Thank you so much. Good leadership and good governance.
And resources, right? For I think that clearly we've seen what the Global Fund proved around HIV/AIDS, malaria, and tuberculosis, and especially around HIV/AIDS, is that resources matter. Matched with good governance, good organization, good planning, good accountability. That kind of when there is a surge of resources directed at a problem, and when those resources are generally well deployed, a lot of lives can be saved and public health can be better protected. And we need a similar effort. I think COVAX is so important for what it is doing. But we need a significantly greater surge of resources, financial resources, technical resources, kind of human resources, into ensuring that COVID-19 is not, yet another story of gross inequity at a global health level.
How do you think we can increase those resources or really deploy them well and manage them well?
I think continuing to make the argument to donor governments and to large philanthropies that investing in scaling up, just as one example, vaccination production capacity around the world, would just be a really good investment, kind of morally, but also probably, if we can't kind of persuade kind of a government or a philanthropy of the moral case, also a really important financial case. I mean, it would take only a handful of billions of dollars, which sounds like a lot of money, and it is a lot of money. But still, it is kind of only a handful of billions of dollars to scale up production capacity for the mRNA vaccines that we know are so powerfully effective against COVID-19. And we could do that, in kind of replicating kind of the plants where they're already being produced, where they're being produced, or in kind of distributing kind of vaccine production capacity around the world, which I think would be a really powerful kind of move toward equity, and a powerful, in a great sense, transfer of kind of intellectual know-how and kind of technical know-how, production know-how. And if we think about how many trillions of dollars the world lost in 2020 alone because of the failure of individual governments to effectively manage COVID-19, it really is only a few billion dollars, a handful billion of dollars to do that, either in the United States, if that's a decision, kind of where these vaccines are largely being produced today, or in Europe where they're somewhat being kind of produced, or I would hope more powerfully, really in 2 or 3 new factories, in addition to those elsewhere around the world.
Thank you. I would like to touch upon another initiative of the foundation and also another challenge that is expecting us to overcome once we are over this COVID-19 crisis, or alongside with it, I don't know. It is climate and climate change. In which ways has the Clinton Foundation supported women's integration and private sector engagement as well into this climate initiative you have and other initiatives?
So we do a few kind of different things around climate change and trying to help kind of build better systems, better kind of agriculture systems, or kind of better systems in terms of the work that we've done to try to help there be more kind of climate smart building codes and kind of a variety of efforts that we hope make a difference. The one that you're kind of asking about, though, is one that I'm particularly committed to, which is our women in renewable energy work, which is yes, partly in the private sector, although we also work kind of with public utilities, across the Caribbean, because so many of the island nation states in the Caribbean are still incredibly dependent on diesel and quite dirty fuel for their just basic electrical grids. And so, helping the countries at kind of a national level plan to transition, since many kind of have the potential capacity to transition to wind, solar, geothermal, clean renewable sources of energy, is part of the work. But also part of the work is ensuring that the people kind of doing the work and hopefully leading the work really look like the country's populations themselves. And so, trying to help turn energy from a heavily male dominated industry in both the public and the private sectors to being one that is far more gender balanced, because we believe that gender equity is both kind of the right thing to not just strive for, but to solve for. We also believe that better decisions are going to be made, especially when it comes to sustainability. And we have real research that shows that women in leadership positions are far more likely to make kind of more future-oriented investments, whether that is in energy or healthcare, or really in any area.
Fantastic initiatives, really. And another big initiative you have is related with youth, and it is Clinton Global Initiative University, which provides leadership development to young people, culminating in an annual meeting, which is awarded over $4 million since 2007. And youth is very important to us at WHF. We have a youth council, and through which we are supporting all youth initiatives, and we try to provide a seat to youth leaders on the table. Can you tell us more about CGIU? It's very important to, I think, our audience and youth representatives who are listening to us today. And also within CGIU, you have set up a COVID-19 Student Action Fund. What were the main objectives and outcomes for this program? Can you elaborate a little bit more?
Yes. So I think we've now had more than 12,000 students who've been part of our CGIU programming in the last dozen plus years. And we've had students from 180 countries, so almost every country in the world, and representing hundreds and hundreds of colleges and universities. And every student who applies to CGIU applies with kind of the challenge they're tackling and kind of what we call the commitment to action, kind of what they're going to do to tackle it. So whether that is decreasing food waste on their university campus or kind of providing more STEM training and mentorship, so kind of math, science mentorship to girls in their home community, or whether that is working kind of with partners around the world to develop kind of better solar technology, or kind of helping to provide education to young people who are internally displaced or who are refugees. I mean, we've had kind of students tackle so many different challenges, and we try to help them really refine their commitments to action. So to make it kind of more specific, help them think about how will they fundraise for it if that is something they need to do, how they think about partnership, how they think about kind of their work beyond just, especially if it is oriented toward their school or university, how they think about it kind of once they will have graduated, how do they think about building kind of in sustainability. So there can be successors to their work to continue it, or do they want to take it with them as they leave? And we really also try to help build a community of young leaders who are committed to positive social action. And I think that's arguably the most powerful part of our work, is just being the catalyst and the convener for these young people to find each other, not only kind of in their class of CGIU students, but also kind of in previous and future classes of CGI students. And the COVID-19 Student Action Fund really grew out of students saying they wanted to do kind of these specific things, but they needed a little funding to do so. So we had, I think, just under 24 students. We had, hundreds apply about 24 who were accepted, who were provided kind of seed funding, some of whom are tackling like very specific questions, like young people who are tackling how to solve transportation challenges for people in their community to be able to get to COVID testing safely, to people who are trying to solve challenges working with others on how to improve the virtual learning experience for children in elementary school, to how to help kind of there be kind of cheap reusable face masks for healthcare and other frontline workers, and so much else. So we've had just such an amazing array of student solutions that we're really proud to be able to support.
It's a fantastic initiative, and we really encourage this program. And if there is anyone who would like to apply to the program, we really encourage that. Is there any way you can advise how the students can apply and be part of CGIU?
Yeah, absolutely. So you can go to the CGIU website, or you can find it through the Clinton Foundation website. We had our first virtual CGIU in April. We were supposed to be at the University of Edinburgh, but clearly because of where we were with the COVID-19 pandemic, we had to have our first virtual program. And we then were able to have a series of virtual convenings, especially in partnership with Howard University here in the United States in the last autumn. And we certainly will be having CGIU this autumn, and really would welcome any and all who want to apply. We don't know yet whether it'll be safe enough to have it in person, or whether we'll have a hybrid, or whether we'll still be virtual. So I can't tell you that because my crystal ball isn't sufficiently clear to know where we will be in the COVID-19 pandemic. But I think that it will be a great experience, whether it will be in person, online, or some combination of the two. So I hope you will apply.
I'm sure it will be fantastic, and let's keep the positivity, and let's assume everything will be back to a bit of normality in the second half of 2021. My another question to you, Chelsea, is going to be about SDGs. We are in the decade of action, and in the last digital summit we had during United Nations General Assembly, we discussed heavily about where it is going to go. Really, we are just left with 10 years to achieve sustainable development goals, and naturally at the moment, given the impact of the pandemic, we will not be able to achieve them all. And with this in mind, we should be aiming to focus on some certain goals which have cross-sector impact, and depending on the connectedness nature of the SDGs. Can you analyze for us the impact of the Foundation's initiatives on different SDGs, and what are your thoughts on this decade of action?
I think it's such an important question that we all are constantly asking ourselves, because I do think it is important that we measure progress and keep track of what's working and isn't, whether we're talking about renewable energy, which we've already spoken about, or we're talking about HIV/AIDS, or we're talking about women's rights and inclusion, and we know that that's important because we saw how important kind of measurement really was to helping us achieve most of the Millennium Development Goals. That kind of keeping track of progress, being honest about that progress at a global level, I think was really important in helping us kind of drive toward the MDGs. I do think, though, because of the disruption of COVID-19, we have to be honest about how it has affected everything. We have seen, a huge surge in gender-based violence, right, which is undermining deeply the progress against a couple of the core indicators of the SDGs. Also, more importantly, clearly wreaking havoc on people's lives, especially women and children. And yet, I think recognizing that we have lost ground, hopefully just further commits us to the SDGs. So, if I think about kind of in our own work, at the foundation, whether it is in trying to close the education gaps that we know exist in every country, including our own here in the United States, or whether it's the work we're doing with CHAI to try to help improve kind of childhood nutrition around the world, as well as maintain and increase progress on kind of the number of people who are on antiretrovirals around the world to turn HIV from a death sentence into a chronic condition. I just think we have to keep doing our work, Feraye, while also recognizing that there have been serious setbacks, but we can't be discouraged by those setbacks. Hopefully we're just going to recognize that the progress we've made kind of is a challenge and kind of a push towards optimism of why, even with the setbacks, we just have to keep our focus and keep doing our work.
As you've just mentioned, we have to keep the optimism, and as WHF, we are calling 2021 as the year of hope and the chance really to start building back better. So what is your final message today to our audience, to all the community, to young leaders, to everyone that is listening to us?
I think it's such an important question, right? And I think I truly think every day about something that Jim Kim, who was one of the founders of Partners in Health and then the president of the World Bank, said, which is that optimism is a moral choice. That it is a moral choice to be optimistic, to believe that tomorrow can be better, and then to feel responsibility to making that belief true, to kind of proving kind of the belief had validity kind of through our energy, our actions, our partnership, our collaboration, our work. So I would just say to anyone, I hope that you are optimistic and that you are hopeful. And I hope that even if you aren't, you will create that optimism and that hope for yourself and others through what you do.
Thank you so much, Chelsea. It has been a pleasure to have this fantastic conversation with you. I'm sure our audience will just love it. And we look forward to the next one. I don't want to take too much time of yours today. And only thing we can say is thank you deeply.
Thank you so much, Feraye. Thank you so much.